The following presentation is meant to provide you with information on how the Cancer Center works, the basics of chemotherapy, and who to call or message if you need help. Please do not feel pressured to remember everything that is discussed today. This is meant to serve as an introduction. After you view the educational video, you will have an appointment scheduled with a Cancer Center nurse to discuss your specific treatment plan and any additional questions you have. At UCSF, your healthcare team is here to support and guide you throughout your cancer journey and beyond. This video contains a lot of important information, but you don't need to absorb it all in one viewing. We encourage you to watch and re-watch this video as many times as you'd like, and include friends, family members, and caregivers. Helpful information to write down as you watch the video include questions to remember to ask your care team, important notes for yourself, and if you'd like to re-watch a specific portion of the presentation, you can note the slide number found in the bottom left corner of the frame for your reference. Please use any note-taking strategy that works best for you. This presentation is divided into 3 sections. In the first section, we will cover important information about managing your care. This includes details about MyChart, how to communicate with members of your care team, tracking your symptoms, advanced care planning, and tips to help you navigate your care. In the second section, we will discuss chemotherapy. We will review what to expect on your first day of treatment and how to prepare for your infusion. We also will discuss how chemotherapy works, side effects that some patients may experience, and how to manage side effects if they do occur. In the last section, we will introduce the many programs and services available to you as you go through treatment. We will review support programs, cancer resources, social work, and more. If you haven't already, we highly recommend that you sign up for MyChart at ucsf.mychart.org. MyChart will allow you to communicate directly with your healthcare team, view your upcoming appointments, update your medications and allergies, refill medications, view your test results and important visit notes, view your health information on your mobile device using the MyChart app, allow your care team to share important forms and handouts with you electronically. MyChart also has many other benefits. We rely on MyChart for timely and efficient communication with you, so please contact your healthcare team if you have any questions about signing up. There are many reasons for you to reach out to your healthcare team. If you are experiencing unexpected or uncontrolled symptoms, need an appointment, or have a request, please notify us. You may call or message us via MyChart, but we ask that you reserve MyChart for non-urgent communication only. If you are calling after hours, on a weekend or holiday, your call will be returned by an on-call provider. Please reserve any non-urgent questions for our regular business hours of Monday through Friday. If you have emergent symptoms at any time, call 911. MyChart is a great tool which you have access to 24/7. However, your messages are only reviewed during business hours. Examples of reasons to use MyChart include appointment requests, medication refill requests, test results or treatment questions, or any other non-urgent issue. It's important that you reach out to your care team if you have any questions or are not feeling well. We are here to support you. Many UCSF clinics use a call center to answer the phones. If your clinic works with the call center, when you call, you will be placed in a short queue to speak with a transfer agent who will ask you about the nature of your question or concern. The transfer agent will provide this information to your healthcare team. Your healthcare team will review your medical record and call you back as soon as possible. If you have an urgent issue, the transfer agent will alert the nurse who will prioritize your call. If you are experiencing an emergent or life-threatening event, please call 911 or go to your nearest emergency room. We encourage all patients to complete an advanced healthcare directive, regardless of health status or age. Advanced care planning involves documenting your preferences for the types of medical treatments you do and do not want. It also involves identifying someone who can make decisions for you in the event that you are unable to do so yourself. If you already have an advanced healthcare directive, please provide a copy to your care team. Our UCSF Advanced Healthcare Directives, pictured on this slide, are available online. You can also put together an advanced directive through a program called Prepare at prepareforyourcare.org. The Prepare website uses videos and stories to help people think through their values and goals for medical care. If you have any questions about how to prepare an advanced directive, please contact your nurse or care team. It's not easy to remember it all. We encourage you to keep track of changes in your health, the medications and supplements you are taking, and any new tests, treatments, or procedures. It is also helpful to note the date of any changes, whether they are in regard to a new symptom, test, or medication. Keep this information in a place that's easy to access and update, such as your smartphone, laptop, or notebook. It may also be helpful to make a list of all the doctors and healthcare providers you are seeing, noting their specialty and why you are seeing them. We encourage you to bring this information with you to your appointments in case you need to reference it when talking to your care teams. This calendar of symptoms is one way to track your symptoms in a simple table, but there are many alternatives. We encourage you to find a way that works best for you. In the next section, we will provide an overview of chemotherapy, what to expect on the day of your treatment, and common side effects. On the day of your chemo appointment, we recommend you bring the following items: quiet activities, food, and water, layers to feel warm and comfortable, a list of current medications, including herbal supplements, a list of new symptoms, or any questions to ask your care team. Call and let us know as soon as you can if you can't make your appointment. Have your labs done prior to your infusion appointment per your clinic's instructions. Please allow time for transportation and parking, and be sure to make arrangements for a ride home following your infusion. Chemotherapy, or chemo, is a medication that stops or slows the growth of cancer cells. Depending on your cancer, chemotherapy may also be given in combination with immunotherapy, radiation, and/or surgery. Chemo works by attacking cells that rapidly grow or divide in your body, which includes cancer cells. Unfortunately, chemo also attacks non-cancer cells that rapidly divide, like hair, fingernails, as well as the cells inside your mouth and GI tract, which may lead to side effects. The side effects you experience vary based on the type and amount of chemotherapy you receive, as well as how your body reacts. You may experience a lot of side effects, only some, or none at all. In the next section, we will review some of the most common side effects of chemotherapy. Please discuss with your care team if you have any questions about side effects specific to your treatment. Chemotherapy and low blood counts will make you feel tired and worn out. Many different factors contribute to the severity and duration of fatigue you may experience. Fatigue impacts everyone differently and may extend weeks or months after treatment is over. There are many ways to help manage fatigue. Good nutrition, planning time to rest, and taking short 20 to 30-minute naps early in the day. 30 minutes of light exercise daily, such as yoga, swimming, or short walks, can help with your energy levels. Plan your activities for a time when you feel the best, and don't forget to let others help you, especially when you're feeling fatigued. Please visit our Patient and Family Cancer Support Center to locate supportive resources to help manage fatigue. Services available include free exercise classes and counseling, free nutrition counseling and workshops, and much more. For more information about these support services, please visit the Patient and Family Cancer Support Center website. Nausea and vomiting are common and sometimes serious side effects of cancer treatment. Nausea is feeling queasy, sick to your stomach, or like you might throw up. Vomiting is throwing up the food and liquid in your stomach. These symptoms can be mild or severe, depending on the type of chemotherapy you get and how your body reacts to it. It is important to remember that chemotherapy-induced nausea is not cumulative. Unless your chemotherapy drugs change, the nausea you experience with your first cycle of treatment will be similar to the nausea you experience during your last cycle of treatment. Mild nausea and vomiting can be uncomfortable, but does not usually harm your health. Vomiting a lot can cause other health problems, such as dehydration, weight loss, and fatigue. Always tell your doctor if you feel nausea or experience vomiting, even if it is mild. there are many anti-nausea medications available today. You may take one medicine or a combination of medications prescribed by your care team to help prevent or reduce these side effects. It is important that your nausea and vomiting are carefully managed. If they aren't, these problems can affect your daily life, mental health, physical health, and even delay treatment. Luckily, there are many tips to help manage nausea and vomiting. First, take your nausea medications as directed, even if you are not experiencing nausea. It is much more difficult to control nausea once it starts, so prevention is the best control. Next, eat small, frequent meals throughout the day and avoid alcohol, caffeine, spicy food, and fatty or greasy food. Instead, select soft and bland foods. Eating meals with a blend of carbs and proteins may also help relieve some discomfort. Additionally, try not to eat right before you go to bed or lay flat. It is best to sit upright for 2 hours after eating. Don't exercise right after eating, as exercise may slow digestion and increase discomfort. Lastly, it is essential to stay hydrated. Always keep a drink by your side. Diarrhea is frequent, loose, or watery bowel movements or stools. Although mild diarrhea can be unpleasant, it usually does not cause serious health problems. However, severe diarrhea can lead to dehydration. To manage diarrhea, avoid caffeine, alcohol, dairy, fat, fiber, orange juice, prune juice, as well as greasy and spicy foods. Avoid medications like laxatives and stool softeners. Eat small meals that are easy to digest. Some examples include bananas, rice, applesauce, and toast, also known as the brat diet. Limit your intake of beans, broccoli, seeds, nuts, greens, berries, prunes, and corn. Make sure to peel the fruit before eating and avoid raw vegetables. To prevent dehydration, drink water and other clear liquids. If you have diarrhea during treatment, please ask your healthcare team how to manage it. It is important to notify your care team if you have more than 3 stools within 24 hours. Constipation is when your bowel movements become less frequent, painful, or dry and difficult to pass. Constipation starts when the body absorbs more water or signals food to move through the bowels more slowly. It is a common but controllable symptom. Some signs and symptoms of constipation include pain and cramping, swelling in the abdomen, appetite loss, nausea, and vomiting. To help manage constipation, be sure to stay hydrated and eat foods that are high in fiber, such as whole grain breads and high-fiber cereals. Try to walk or exercise at least 20 to 30 minutes every day to help keep your bowels moving. Please notify your care team if you have gone 2 days or longer without having a bowel movement. Discuss constipation management and medications with your care team, and be sure to notify your care team immediately if you have sudden onset of abdominal pain, are not passing gas, a new onset of nausea and vomiting, or if your stomach feels swollen and hard. Chemotherapy treatments cause a drop in your blood cell counts. One test that is routinely done before treatment is called a complete blood count, or CBC. Your care team monitors your CBC results to make sure that your counts are safe for treatment. When checking your CBC, your doctor reviews your white blood cell, red blood cell, and platelet counts. The white blood cells that fight infection are called neutrophils. When your neutrophil counts drops, it is called neutropenia. Red blood cells carry oxygen throughout the body. When your red blood cells drop, it can cause anemia. Platelets help stop bleeding by forming blood clots. When platelet counts drop, this is called thrombocytopenia. We will review each of these in greater detail in the upcoming slides. Neutropenia can make it difficult for your body to fight infection. Signs of infection include fever, chills, sweating, body aches, headache, sore throat, cough, shortness of breath, congestion, burning with urination, redness, swelling, or pus drainage from an injury or surgical site. A temperature of 100.4 degrees Fahrenheit or higher is considered a fever during treatment. Make sure to have a reliable digital thermometer at home to check your temperature while undergoing chemotherapy. When taking your temperature, use a digital oral thermometer and be sure to wait 10 minutes after eating, drinking, or smoking. Notify your care team immediately if you experience fever, chills, or signs of infection. There are many preventative measures you can take to avoid getting sick. First, practice food safety. Thoroughly wash your fruits and vegetables prior to eating. Make sure that your food has been stored properly and cooked at the appropriate temperature. Do not consume raw meat and avoid public buffets where the food has been sitting out or has the potential to be contaminated. Next, keep your body clean by showering and bathing daily and avoid touching your face. Stay away from people who are sick. It is encouraged to see your friends and family while on treatment. Just be cautious of your surroundings and keep your distance from those who are actively sick. Wash your hands often, especially before eating and after using the bathroom. Many people with anemia feel fatigue or weakness. Symptoms of anemia may also include rapid or irregular heartbeat, occasional chest pain, trouble breathing or shortness of breath, dizziness or fainting, pale or lighter than normal color of the skin, nail beds, lips, gums, or tongue, and headaches. If you experience any of these symptoms, please notify your care team. Thrombocytopenia, or low platelet count, is a side effect of cancer and treatment. If your platelet count is low, you may or may not have symptoms. Common symptoms include increased bruising, flat, small purple or red dots under your skin, nosebleeds or bleeding gums, black or bloody-looking bowel movements, red or pink urine, vomit with blood in it, an unusually heavy menstrual period, severe headaches, feeling weak or dizzy, difficulty stopping bleeding from a nosebleed or a cut. Notify your care team if you experience these new or worsening symptoms. Cancer-related pain affects many people, which may lead to significant discomfort and a lower quality of life. Pain can come from the tumor itself, the cancer treatment, or causes unrelated to cancer. Common treatment-related pain are neuropathy and joint pain. Neuropathy pain is numbness in the fingers and toes. Usually this pain improves or resolves when treatment is finished, but sometimes the effects can be lasting. Joint pain can occur in the hands, feet, knees, hips, shoulders, lower back, spine, and other joint areas. Joint pain can affect a person's quality of life and make other symptoms or side effects of cancer worse. Make sure to discuss your pain with your care team. Most pain can be effectively treated. A good pain treatment plan will take care of pain from all causes, cancer-related or not. Neuropathy is caused by damage to the peripheral nerves from chemotherapy, cancer, or both. There is no proven way to prevent neuropathy. It presents as numbness and/or tingling or burning in the fingers and toes, often described as pins and needles. Neuropathy is a cumulative side effect, meaning that it will get worse with each cycle of treatment. It can take up to a year following your chemotherapy for neuropathy to resolve, and it does not always resolve completely. Acupuncture can help ease the discomfort caused by neuropathy. Make sure to let your care team know if your neuropathy is causing you to have trouble sleeping or difficulty with tasks such as buttoning your shirt. It is important for your provider to know if your pain is impacting your ability to complete your normal activities or is affecting your quality of life. Some cancer treatments have side effects that affect a person's mouth, teeth, and salivary glands. Fortunately, you can work with your care team to lower the risk of these side effects and manage them if they do happen. Side effects of the mouth caused by cancer or its treatment may include thickened saliva, tooth decay, inflammation of the mouth or tongue, changes in taste, mouth or throat sores, white coating on your tongue or cheeks, infection, and dry mouth. Mouth problems are more serious if they interfere with eating and drinking, because they can lead to dehydration and/or malnutrition. It's important to call your care team if you have pain or changes to your mouth, lips, or throat that make it difficult to eat, drink, or sleep. Prior to starting treatment, please notify your care team if you have a history of mouth ulcers. At the start of treatment, it is important to get into the habit of using baking soda and salt rinses at least 3 times each day to prevent mouth sores. Salt and baking soda rinses consist of 1 teaspoon of salt and 1 teaspoon of baking soda mixed with 1 quart of water. Gargle the solution in your mouth and spit it out. Repeat 3 to 5 times a day for the best results. Other important tips to manage oral health care include seeing a dentist before you start treatment. You will need to avoid dental procedures during treatment unless approved by your care team. Avoid smoking, as well as food and drinks that are spicy, acidic, have high sugar content, or contain alcohol. Brush with a soft bristled toothbrush and talk to your care team about flossing. Avoid using oral products with irritants such as alcohol, hydrogen peroxide, iodine, thyme, or whitening agents. Some types of chemotherapy can cause changes to your nails and skin. Your nails may change in texture, color, and thickness. You may also experience cuticle changes. To help keep your nails as healthy as possible, keep them clean and trimmed. Please contact your care team if your fingernail starts to lift up or you experience pain or drainage in the nail bed. Skin changes are also common while receiving chemotherapy. Your skin may become very sensitive to the sun and burn easily. This is called photosensitivity. Be sure to protect your skin from the sun at all times. Your skin may also become dry, but applying a daily skin moisturizer all over your body can help. You should make sure to keep your skin hydrated using a lotion that does not contain dyes or perfumes. A rash may occur, but it is not expected. If you develop a rash, please contact your care team and send a photo through MyChart for review. You may recall that chemotherapy can attack other rapidly dividing non-cancerous cells, such as hair. Most often, hair loss begins 2 to 3 weeks after starting chemotherapy, but may start earlier or later depending on how your body reacts. Some people will lose relatively little or no hair, while others may lose the hair on their head, eyelashes, eyebrows, and other body hair. Not all chemotherapy causes hair loss. Your scalp may feel itchy or sensitive, but be gentle when brushing and washing your hair, and try to avoid too much pulling, like ponytail holders, blow drying, curling, and flat irons. Your hair may be slightly different in color and texture after chemotherapy. Regrowth of hair starts approximately 2 months after the last dose of chemotherapy. There are several resources available should you choose to buy a wig or other scalp covering. The Friend of Friend specialty shop has a great selection of wigs and other scalp coverings and offers a free wig trim and styling tips. More information is available at 415-353-7776 or online at friend2friend.org. The American Cancer Society's Tender Loving Care program is another great resource for purchasing wigs, hats, scarves, and other head coverings. These may be partially or fully covered by your health insurance. If so, ask your healthcare team for a wig prescription, which is typically written as a cranial prosthesis. Sexuality is the sum of feelings and behaviors we have about ourselves and others as sexual beings. It includes how we feel about our bodies, how we feel about touch, and our thoughts and emotions. Some treatment regimens can cause changes in our sexuality. Chemotherapy may alter hormones, libido, and may even cause physical changes to the body. Hormone changes can lead to side effects such as vaginal dryness, early menopause, difficulty with erection, or impotence. These are just some of the effects treatment may have on your sexual health. Need help starting a conversation with your healthcare team? Feeling anxious or embarrassed about bringing up sexual concerns with your healthcare team is common. Writing your concerns or problems down before your appointment may help. Try using the script on the bottom of the screen. Cancer treatment may cause changes to ovaries or sperm, which can lead to fertility challenges. Early intervention is important if you are considering children in the future. Be sure to discuss family planning with your care team as soon as possible and before you begin cancer treatment. To learn more about preservation options, those designated female at birth may contact 415-353-9115, and those designated male at birth interested in sperm preservation may contact 415-353-2200. If applicable, make sure to discuss pregnancy prevention with your care team prior to initiation of treatment. Chemotherapy poses risks for birth defects, and pregnancy can be dangerous during treatment. Your provider will discuss options for birth control and may recommend a change in your birth control depending on your diagnosis and treatment regimen. Chemo brain is a term used to describe temporary memory loss or forgetfulness during chemotherapy treatment. Chemo brain is often described as a mental fog, and you may have some difficulty with finding words. The causes of chemo brain are primarily fatigue, medications, hormonal changes, and stress, depression, or anxiety. Some strategies to cope with chemo brain include keeping a planner, creating an ongoing list of questions for your care team as they arise, exercise your brain through stimulating activities, and maintain good nutrition. Each chemo medication passes through the body differently, but most of the chemo waste comes out in your bodily fluids like urine, stool, tears, sweat, blood, and vomit. Chemo waste may also be in other body fluids such as fluids from semen and the vagina. In general, it takes 48 to 72 hours for your body to get rid of chemotherapy. During this time, there are many things you can do to reduce exposure for you and your loved ones. If possible, use a dedicated toilet. Put the toilet lid down before flushing to reduce splashing, and flush twice. Always wash your hands with warm water and soap after using the toilet. If you vomit into a bucket or basin, carefully empty it into the toilet without splashing and flush twice. Wash the basin with hot soapy water and empty this water into the toilet as well. Caregivers should wear 2 pairs of disposable gloves if they need to touch any of your body fluids. They should always wash their hands with warm soapy water, even if they had gloves on. If a caregiver comes into contact with body fluids, wash the area very well with warm water and soap. Any clothes or sheets contaminated with body fluids should be washed in the washing machine with warm water, regular detergent, and without any other clothes mixed in. If using disposable underwear, adult diapers, or sanitary pads, seal them in 2 plastic bags and throw them away with your regular trash. You may notice changes in your mood, relationships, body image, intimacy, and sexuality, work or financial stressors, and your ability to manage stress. Fortunately, there are many options for coping with these emotional and social stressors, including using available social support, accepting help from others, being patient with yourself and others, staying as active as you can, and utilizing our supportive resources at UCSF. UCSF offers a wide variety of programs and services to patients, family members, and caregivers. You can use as many or as few of the services as you'd like. You can get an overview of all our patient support programs by visiting our main patient support site at cancer.ucsf.edu/support. Here you can find an A through Z listing of all our services, prescriptions for healing document, and much more. You can also contact the Patient and Family Cancer Support Center, which serves as a main hub for patient information and support. Staff and volunteers at the center can direct you to many resources and programs. You can contact the Cancer Support Center by phone at 415-885-3693 and pressing option 5, or by email at cancersupportcenter@ucsf.edu. Our oncology social workers are dedicated to helping patients and families navigate the healthcare system and manage the challenges of living with cancer. Social workers can help you manage the stressors of cancer such as emotions, work, insurance, finances, and more. They can help you navigate family leave and disability benefits, help you find lodging and transportation, support you in documenting care wishes through an advance directive, and connect you with community resources and support programs. They are skilled in helping patients and families cope with cancer. They can also put you in touch with supportive care teams such as palliative care or hospice. Social workers are available to meet with you, your caregivers, and members of your family during your medical visits or by phone. To contact a social worker, ask a member of your care team for a referral or call 415-353-4762 and ask to be connected with the social worker assigned to the clinic where you are being seen. Our peer support patients are also available to talk with you. Each one of them has received cancer care at UCSF and has undergone training through the Cancer Support Center. They are eager to connect with you to share their cancer experience, practical advice, and strategies for coping. We can match you up with a peer support patient based on your type of cancer, the treatment you are receiving, or other life situations, such as having young kids, an advanced cancer, or a very rare cancer. To get a call from a patient peer volunteer, call the Patient Support Center at 415-885-3693. Select option 5, or click on the Peer Support Program on the main patient support site, cancer.ucsf.edu/support. The Osher Center provides integrative cancer care by blending conventional treatment approaches with complementary approaches such as acupuncture, Ayurveda, guided imagery, massage therapy, and more. The Osher Center strives to promote healing and well-being of the whole person, mind, body, and spirit. The Osher Center New Patient Navigator can help you to determine which treatment, service, or program is best for you. Please call 415-353-7716 to speak with our New Patient Navigator, or use our online form to request an appointment. To learn more about the services and programs the Osher Center has to offer, please visit osher.ucsf.edu. We look forward to serving you and making your experience the best it can be. Thank you for choosing UCSF to receive your care. The educational material in the presentation was derived from the following sources: